Well, good afternoon. It's always a challenge to come after lunch, so I think, but I'm excited to be here. This is my first time attending the A4M meeting, and I'm really thrilled to be able to share with you on a subject that is really dear and near to my heart, and obviously my skin, which is energy-based skin rejuvenation of ethnic skin. And I am a cosmetic dermatologist, and I have a private practice in San Diego, California, and obviously in that population of probably the same here in Las Vegas, multiculturally diverse patient population. I'm proud to say that about 50% of my patients are non-Caucasians, and that includes, Mexicans. I'm Filipino by descent, and Asians, Hispanic, African Americans, and East Indian patients, anyone who's non-white. About 50% of my patients are non-white, and I'm able to really perform, a lot of amazing skin rejuvenation techniques, and those are the things I'll share with you today. So, skin rejuvenation of ethnic skin, there is truly a huge interest, and I've had the opportunity to travel around the world, in Europe, in Asia, and really speak and educate physicians about this important subject. And probably because the number of people with ethnic skin or non-Caucasian skin is exponentially increasing in the world. Here in the U.S. alone, there's over 70 million of us with non-Caucasian skin, and so, we would like, now cosmetic surgeons, practitioners who are in aesthetic medicine are really wondering and trying to learn how to do this right, because historically there's been a lot of problems, there's a lot of miseducation, and there's been a lot of complications, and I've had my own share in my previous practice. And the other thing that's interesting, and probably all of us, because we are now not only doctors, but we are running businesses, that this is truly a largely untapped market. Many doctors all around the world are still telling their patients, sending them away if they don't have white skin when they're coming in for laser hair removal, skin rejuvenation, skin tightening, and it's really, truly a shame if you have to do that because you don't have the right technology. And, really nowadays, there's technology that is specifically designed for non-Caucasian skin, for ethnic skin, and this is the technology that I have in my practice, and I'll show you my own patients before and after. So really both physician and patient education is key, and when patients of ethnic skin come in to my clinic, I definitely educate them about why it's different. It's different to treat Caucasian skin versus ethnic skin. And these also are very special patients. Many of them have had bad experiences and complications from previous treatments like chemical peels, laser, IPL treatments. Many of them have tried many times, series of treatments, and have gotten no results from their treatments. Personally, the first time I actually had my first experience with lasers was as a medical student at Stanford many years ago, and the doctor there, is a really renowned dermatologist, had their hands on the first lasers for leg veins. And so he needed a volunteer, and I had a few spider veins in the back of my knees, and I volunteered, raised my hand, I got on the table, and he zapped me. Zap, zap, zap. It was the most excruciating experience of my life. And, I didn't say anything. I was sweating. I didn't want to embarrass him, but I ran to the bathroom afterwards, and I felt the back of my knees, and there were large blisters. And those blisters turned into dark scars that took 2 years to go away. And that was in the 90s, and then they started telling doctors in aesthetic medicine, do not do laser treatments on patients who are non-white, and for good reasons. And then I finished my training, and as a cosmetic dermatologist, I definitely had my challenges, tried to make IPL and laser devices, fit and treat skin of color. And truthfully, I never had a single IPL treatment on my own skin because of fear of burns and hyperpigmentation. But to tell you the truth now, with the technology that I have in my practice, there's the Syneron elos devices, I treat myself every single month, and it's transformed my skin, as I'm a huge believer. And so, the good news is that patients with skin of color do want to do skin rejuvenation. They want to be part of this anti-aging revolution, but they've been told so many times, or they've had bad experiences, and now we just have to really educate both the public and physicians who are going to be doing the treatment that yes, we can now do these types of procedures safely and effectively. So what is the difference? What's the difference between my skin and, my Irish Caucasian patients? Well, this is a cartoon of the skin. Top layer of the skin is called the epidermis, and this pink area here, very important area, the dermis. The only difference really is that this is the Fitzpatrick skin typing. One is your fair Irish patient, never tans. And I am probably a skin type 4, and you can see that the only difference is that I have a lot more pigment in my epidermis. And that pigment that in the epidermis is wonderful for me when I'm out in Hawaii and, I'm out there in the sun, because it does give me extra protection as compared to, my Irish friend. But that extra pigment in the epidermis, when you're applying and you're using lasers or IPL and light devices and you're applying energy on the top layer of the skin, that pigment now acts as a barrier. And all that we do in rejuvenation and all that we do in this field is really about heating